Welcome to our YouTube channel. I am Keisha with Keto Coaching with Keisha. Today we've had the amazing opportunity to have a candid discussion with none other than Dr. Ken Berry. Dr. Berry is actually a board certified family physician. He's been a doctor for 20 years now. Dr. Berry goes into a discussion and tells us the truth about keto and the amount of things that keto can help us reverse when it comes to health in the African American community. So before we move on, please take a minute to hit that subscribe button so every time we have a discussion or post new information, you'll be one of the first to hear about it.
Okay, we are ready to go.
All right.
So first, thank you so much. Our group is extremely excited about having the opportunity to speak with Ken Berry, Dr. Ken Berry. Like I said, you are one of our keto idols. The things that you have taught have helped us reverse so many things. So today we asked you to come on to discuss a lot of the health conditions that keto could help us reverse, especially in those things will help us reverse these illnesses that make us vulnerable to COVID as well. And of course, in the African American community, these illnesses are very prevalent. And so we wanted to discuss, because it helps when they hear it from a medical professional,
Yes.
that this is true and that we can't, and it is okay for us to do it.
Absolutely. Yeah, that's I love it.
Okay. I know one of the things that I have been looking at when it comes to COVID, and one of the key issues have been the blood sugars. So could you discuss a little bit about how we can use keto to reverse the blood glucose levels?
Yeah. So one of the main things that you can do to quickly increase your blood sugar is to eat carbohydrates, right? And any type 1 diabetic, they know this. If you want your blood sugar to go up very quickly, then you eat some honey, you drink some orange juice, you eat some peanut butter, you eat a bite of chocolate. All that stuff will make your blood sugar go up very quickly. And so one of the key foundational principles of keto is that you don't eat very many carbohydrates, because if you do that, it'll make your blood sugar go up.
Correct. And we know when we go on a ketogenic lifestyle, we cut out all these carbohydrates, so it tends to reverse these abnormal glucose levels, and of course our A1C over time comes down as well.
Right.
So these things are really what would help us if we were to convert to a ketogenic lifestyle to reverse all of these. So why do you think there are so many doctors still who are very hesitant to ask their patients to do keto? Because that's what I hear a lot. Well, my doctor says this isn't healthy for me to do.
Well, I think a lot of doctors are ill-informed, just like I used to be. If you had asked me back in 2003, Doc, do you think I should go on a diet where I eat lots of beef, butter, bacon, and eggs, and don't ever eat any wheat at all, I would have said, hell no, don't do that. That don't sound healthy. But now, knowing what I know that it is the healthiest diet that any human being can eat. It is the proper human diet.
And also, we are seeing an influx of people who are in, don't get me wrong, I don't downgrade anybody's lifestyle, but we see a lot of people who want to promote vegan over keto, saying that that's the most healthiest option. And a couple of weeks ago, I did a trial with vegan keto and struggled big time because of ingredients.
Yeah, there probably are a few very young, very metabolically healthy, very slender people who might be able to pull off a vegan keto.
Right.
Now, if you want to do vegetarian keto and eat eggs and dairy and maybe some shellfish, oysters, shrimp, stuff like that, I think you can do a pretty decent keto diet with that. But if you're just going to be only plant-based vegan, it's going to be really hard unless you're 18 years old, and you're skinny as a rail and you have no insulin resistance whatsoever. It's going to be very, very difficult, if not impossible.
Right. And the other thing that I found when I did vegan keto that week, I struggled to get protein in, for one, because I'm actually ketovore. Actually, I turned to carnivore after learning you were. And so I'm ketovore. And so that week that I did vegan, my body struggled big time. And it was putting up a fight saying, hey, this is not something I really want to do.
Yeah, and something that you don't hear a lot about is the quality of protein. Right. And so if you eat the perfect combination of beans and rice and a few other vegetables or plants, you can get all of the essential amino acids. But the problem is that the protein quality in plants is just not as high as the protein quality of animal based proteins. You are going to be able to absorb and use more of the protein, more of the amino acids from an animal-based food. That's just a physiological fact.
Correct. So also when we look at COVID, one of the other things that we find that those patients have a lot of inflammation, lots and lots of bills, lots of inflammation. So we know that a ketogenic lifestyle is anti-inflammatory. So would being on a ketogenic lifestyle, even if we were to catch COVID, would that help us?
Yeah, 100%. And so first thing you have to understand is that it's well known in immunology that having high blood sugar immediately retards your innate immune system. And that's the first wall of defense of your immune system. And so when you're, and it can be any virus, that's the thing people have to understand. There's a reason that obese type 2 diabetics with hypertension are told to get 2 flu shots per flu season, right? They're more susceptible to the flu, to the cold, to any bacterial infection, to any viral infection. And I think it's for 3 basic reasons. First, their blood sugar is always high, right? Secondly, if your blood sugar is always high, what else is always going to have to be high to cope with that? Your insulin.
Your insulin level.
Right. And then all that together, plus the vegetable seed oils that come with the standard American diet, your body's also very inflamed. And now inflammation, chronic, inappropriate inflammation is always a bad thing.
Right.
But one of the main things it does that makes you more susceptible to viruses is that it gets your immune system all worked up and all confused. Right. And that's also what brings on the autoimmune disorders, is that your immune system is just all hyped up and looking for a fight. And then here's something that you've built out of vegetable oil or plant proteins, and it doesn't look quite right. So all of a sudden your immune system's attacking your thyroid or your skin or your joints, and inappropriately. And so what you want to have to fight off this virus or any virus is a low normal blood sugar, a low normal insulin level, and a calm, wise immune system that's not being distracted by all this chronic inflammation all over your body. When you have those 3 things in order, you're more resilient against any infection without exception. If you do catch the flu or do catch COVID or any other infection and you're keto, your immune system has all the building blocks it needs to fight that. And it is also not having to contend with chronic inflammation in your gut, in your joints, in your skin, in your thyroid. It's not having to fight these multiple battles. It can focus all its resources on fighting this infection.
So what do we tell the people? Because I'm asked often, what are some things that I can take to enhance my immune system? And of course, the first thing I say is it starts in your gut health.
That's right.
So what do we tell the person who is taking all of these things that we see, the elderberry, the vitamin C, the vitamin D, but they're still eating junk and crap on the other hand?
I think it's a particularly American concept that if you're trying to prevent something or trying to fix something, then you got to buy something. You got to add something, right? You got to buy this pill or that capsule or this root or this herb. Those things may help a little bit, but they are in no way the root solution to this. Your body is one of the most amazing things in the universe. It is able to do so many things. With all it needs you to do is to put good food inside it. That's all it needs you to do. Now, if you start eating inappropriate things that are inflammatory, slow poisons, What you're doing is you're slowing down your metabolism. You're crippling your immune system's ability to fight. So rather than people out looking for this latest herb or this latest vitamin, yeah, you can take that stuff. It might help 1 or 2%. But if you're looking for the 90% solution, how do I improve my immune system and make it as strong as possible? It's not adding some root from the Himalayas. It's not adding some herb from Jamaica. That stuff, that's fine, but that's a waste of money. What you want to do is remove the sugar, remove the grains, remove the seed oils, and give your body a chance to heal. Are you still with me? I don't know what happened there. I don't see you. Are you there?
Am back. Had to lost connection for a minute.
Oh, so annoying.
Okay. So we were talking about the or making sure we're doing what we can do eating wise to make sure we're good with our immune systems. What do we say to the people who are with the old-fashioned thinking of, well, that's high fat, and that means that, of course, it's going to give me a heart attack, it's going to increase my cholesterol, and of course, we've always been told that that is just not healthy.
Yeah, that's an old myth that for about the last 50 or 60 years, doctors have believed that myth. It's actually a hypothesis that started in the 50s and 60s.
Right.
It's never been proven. They've performed multiple research studies trying to prove that eating a high-fat diet will increase your risk of heart attack and stroke. Every single study that they've done either showed no effect, or it showed that actually eating more saturated fat decreased your risk of cancer, decreased your risk of infection, decreased heart artery plaquing, and decreased all-cause mortality. Human beings have been eating saturated fat from fatty meat ever since we've been on this planet. How are we going to come along in the 1960s and say, oh, wait a minute, saturated fat is bad for you, when that's what we've been eating, as much of that as we could get our hands on ever since we've been on this planet? It doesn't make any sense. But then when you actually look at the research, none of the research supports that. And the average doctor or dietitian, they just don't know that. They are just repeating what they were taught in school, which is what I did for the first few years of my medical practice until I knew better. Now that I know better, I tell the truth. And most people in the keto carnivore community are noticing that every day, here's a new doctor who's now keto. Here's a new nurse practitioner. Here's a new physician's assistant. Because once they actually think about it for a minute and actually look at the research for a minute, they're like, what the hell was wrong with me? No, none of that make no sense. And so they stop saying that stupid crap and they start saying the truth, which is saturated fat from animal products are very nutritious for human beings, very healthy for human beings, and actually are vital for optimal human function.
Correct. So if you're going to a doctor, because I've actually had a lot of people say this too, I'm going to the doctor, and we even have some people where their numbers have reversed, their cholesterol level, their blood work, everything is near perfect. And we're talking about middle-aged people, but their doctors are still very reluctant and still telling them to want them to come off of doing this lifestyle for some reason.
Yeah. So they're afraid it's dangerous. And what they're really afraid of is they're afraid that you're going to have a heart attack and somehow it's going to be looked upon as their fault. Yeah, that's really what they don't want to happen. And so that's why a lot of doctors, even though they know that statins for cholesterol probably don't do anything to help, they still feel duty bound to prescribe them because it's the community standard of care. All the other doctors are doing it. So if I don't do it, I'm going to look like some kind of freak here. I'm going to look weird to all the other doctors. And then if something bad does happen to my patient, well, lo and behold, you weren't following the standard of practice. You didn't give that patient Zocor, Lipitor, Crestor. Therefore, their death is your fault, and they can sue you. So doctors are very risk averse. They don't like risk. They don't want to take any chances. And so a doctor is never going to get in trouble with the medical board or with an attorney if they follow the standard of care and the community standard of care. even if that's a bad medical practice, they still won't get in trouble for that. And so what I would tell the people, you got two choices. If you really like your doctor, then try to help them understand. Say, watch this YouTube video. Here, I printed this article off for you. Read this when you've got a minute. But if you got one of those doctors that you just soon slap his look at, you probably need to find a new doctor. Because, but I always want people to try. If they like their doctor, try to reason with your doctor and say, think about what you're saying. Think about it. It don't even make no sense what you're saying. And if you can, because what I want people to do out there and what thousands of people have done is they've converted their doctor. And now their doctor's like, oh yeah, keto's fine. You don't need a statin.
Right.
Eat your bacon. Because once you convert a doctor, that doctor's taking care of hundreds of other patients, right? And so you just multiplied your effect times however many patients that doctor's got, because now that doctor is not going to think twice if a patient says, I don't want to take this Zocor, it makes my muscles ache. They'll say, well, stop taking it. You don't need it anyway. Or if a patient says, hey, I heard about this low carb keto diet. Is that okay? That doc's going to now say, yes, it's fine. Just make sure you're eating, lots of meat, lots of veg, maybe eat some berries. You're going to get everything you need from that diet. So now you actually have a keto advocate in that doctor instead of somebody who's just closed-minded and not trying to think outside the box at all.
Right. And I do see a lot more doctors coming on. I've been strict keto for a little over 2.5 years, been carnivore almost a year now. And the amount of doctors that are coming on board saying, okay, it's fine, is a lot different than what it was when I first started. When I first started, I only knew of you guys, I didn't know any local doctors who agreed with it. But now we have a lot of people who are coming on saying, hey, this is what my doctor is telling me to do, because it reverses so many illnesses. And we were talking about how this list just keeps growing and growing and growing about the number of things that it reverses. And what do you think? Because I've often been asked this too. How does the ketogenic lifestyle compare to a lot of these fad diets that we've seen in the past?
Yeah, so I've been practicing medicine for 20 years. So early in my career, I would tell you to join Weight Watchers, join the gym, just move more and eat less. That's all it takes. And it never worked, right? And so every fad diet out there, whether we're talking about Weight Watchers, Jenny Craig, flexitarian, Ornish, vegan, all of these diets are starvation diets.
Yep.
Right? That's what they are. And then if you fail, when you fail on their starvation diet, which is, it's human nature not to want to starve yourself. That's one of the beautiful things about keto is you get to eat till you're full and you get to eat delicious food. So if you're on Weight Watchers, for instance, and then you're like, well, dang, I only got how many points? I'm already out of points and it ain't even dinner time yet. What am I supposed to do now? Well, you're supposed to just go hungry until the next day. Well, nobody can do that forever. No human being, unless they're insane, can starve themselves for the rest of their life. So that's not sustainable at all. But when you finally give up, which I would phrase that as wise up or wake up and say, I'm not going to starve myself forever. This is stupid. Then they're going to call you a glutton and a sloth. And then it becomes a judgment against you. Oh, well, you're weak. Oh, you don't have enough willpower. Oh, you just like the honey buns too much, right? That's the kind of stuff that they may not say it out loud, but that's what they're thinking. So they get to judge you. It definitely wasn't their fault because you quit, you gave up. Well, the task that they gave you was insurmountable. No human can starve themselves for the rest of their life. That's not even natural to ask somebody to do that. That's like something some cult would ask somebody to do. Oh, to be a part of this cult, you have to starve yourself for the rest of your life.
Right.
I don't want to be in that cult. I want to be in this keto cult where I get to eat bacon and hamburger and eggs and bacon and butter until I'm full and then go about my business. I would much rather be a part of this group.
Good. And that's the other thing that I'm usually confused about, because a lot of people think that they have to give up taste of food. I'm like,
well, on so many of those other diets, you do. You have to eat food that tastes like cardboard. And the reason it tastes like cardboard is because it's nutrient void. Doesn't have any nutrition in it.
Exactly. One other question I had, when we look at the whole laundry list of health issues, one that's really on the rise right now, with the leading causes of death in America, is the cancer
Yeah.
rate of cancers. And we also know that keto is extremely effective when it comes to preventing cancers, as well as when it comes to actually help treating cancers. Could you talk to us a little bit about that?
Yeah, it's very simple. Cancer loves sugar.
Right.
Cancer has to have sugar in order to metastasize and to grow and double and double and double and double. It's got to have a lot of sugar to do that. So it has to have a sugar-rich environment. If you're suspected of having cancer, the doctor will send you to the hospital for a PET scan, right?
That's right.
The way a PET scan finds cancer is that actually the molecule they use in the PET scan has sugar in it.
That's right.
And so cancer gobbles up all the sugar cells. And then on the PET scan, you can see, oh, this tissue right here is sucking up a lot of sugar. That's how we find cancer in your body, is where's the tissue that's sucking up the most sugar. That's what PET scans look for. And so you'll actually hear people out there say, well, there are cancers that can live on ketones and other things. And there are some cancers that can limp by on ketones. They can stay alive. But in order for a cancer to thrive and multiply and eventually kill you, it's got to have sugar. There's no ifs, ands, or buts. It's hands down. You don't even have, there's no debate. And so by eating a low sugar diet, which is what low carb means,
right,
you've got plenty of protein, amino acids, plenty of fat, plenty of fatty acids, and you've got a little bit of carbohydrate if you're eating some dark green leafy greens. But you're not just loaded up with sugar like somebody who's eating all the desserts, and not even all the desserts, eating all the whole grain bread and all the fruits that we're told are so healthy. If you're eating that stuff, if you've got a little cancer somewhere, you're feeding the cancer. The cancer says, thank you.
Right. And this was funny that you mentioned that, because I was actually just in this discussion yesterday, where so many people still think that just because it's fruit, just because it's a vegetable, or just because it says whole grains, because that's what we've been taught, that is a lot healthier for us. And it really isn't. It still converts to sugars.
Sure. So a great analogy is, so we got 2 slices of the old white bunny bread. You heard of bunny bread?
Right.
Okay. Now, are 2 slices of whole wheat, stone ground bread, is that better than bunny bread? Well, yeah, it's a little less bad. And so if you just consider bunny bread, just old white bread, to be an unfiltered cigarette, then whole wheat bread would be a filtered cigarette. It's a little less bad for you, but it's still a damn cigarette.
Correct. Okay. Well, we really appreciate you coming on. Is there anything you want to add? Like I say, the group has been excited ever since we got the invitation. I told them, pray I'm able to speak, because everyone knows Dr. Berry is my keto idol. But is there anything that you would like to add?
Yeah, I really want to talk just one more minute to your people of color that I know you've got people following you. You guys, you got to listen. African Americans you're even worse at metabolizing carbohydrates than white folks.
That's right.
Your blood pressure is immediately going to go up if you're eating too many carbs. And whereas, some white folks, we just get fat. And we don't ever really develop any of the chronic diseases for decades. And it's just a difference in genetics. But black folks, y'all get high blood pressure, boom, quick. And then that high blood pressure destroys your kidneys. And then you're on dialysis. You develop type 2 diabetes quick. And then in a few years, you're blind or you've lost a leg, right? I mean, it's just, and it's really, of all ethnic minorities, they don't metabolize sugar as good as the average Caucasian American. And that's just a fact of biology. You guys got to go out of your way to eat as low carb as you possibly can. And I mean, I know the world right now feels like we're not in control of anything, don't it? But I'm telling you, if you take control of your diet and you control what goes in your mouth, That's the first step in taking control of other stuff. But in my practice in Camden, I probably had 10% of my population was African American, and their rates of hypertension, of type 2 diabetes, of fatty liver, of being on dialysis, of having retinal issues in the eye and being blind, sky high, double, triple the risk for my white patients. And it's not because of a difference in the quality of care, because I loved all my patients. I told everybody the same thing. But it's the genetics, man. You guys are much more susceptible. So if any minority is going to benefit from low carb, keto, carnivore, it's the African American community. I'm telling you, it could just slash the rates of heart attack, stroke, amputation, blindness, dialysis, all that stuff would just be a distant, sad memory if you could just embrace keto and just make it part of your life.
And since you mentioned that about the hypertension, one of the other things that we were always told that it was the sodium that's in our diets when when that's not actually the root cause of even that. So could you tell us a little bit about what the root cause actually is?
Yes. So the root cause of hypertension is a change in fluid dynamics. So if you're eating a high carbohydrate diet, then you're going to have high blood sugar. That's going to make you hold more water.
That's right.
You're also going to have high insulin because of the high blood sugar. That's going to make you hold more water. And the average person who's obese or morbidly obese, they're holding anywhere from 10 to 30 pounds of just inappropriate water in storage because their blood sugar and their insulin levels are high. Now, if you're eating a high carbohydrate standard American diet, eating too much salt might make your blood pressure go up.
Correct.
But when you're on keto, when you've got a low normal blood sugar and a low normal insulin level because you've been eating very low carb, you get, one of the beautiful things about keto is you get to salt to taste. If it ain't salty enough, put some more salt on it. And use a good quality salt like Redmond's real salt. Don't use that cheap Umbrella Girl salt. It doesn't have nearly as many minerals in it. Use a real salt and salt your food until it tastes salty enough for you. You get to do that with keto, and that's not going to raise your blood pressure, and it's not going to make you hold fluid or have edema or swelling if you're on keto.
Correct. It has, when I first started keto, of course, it was just to lose a few pounds, all main reasons. It wasn't until the more I got into it, the more I started researching, that I realized that a lot of the things that we were taught just haven't been correct. We really appreciate, people, especially like you, who really come out and tell exactly how it is. And I'll be honest with you, one of the reasons I fell in love with your approach in the beginning, because you were so real with it. And your book, Lies My Doctor Told Me, all these things, I was just blown away with all of the things that we had been taught that were wrong. And the sad part about it is, especially those of us who are in the African American community, it has affected us the most.
Absolutely. Absolutely. Yes. And it's egregious. I mean, it's terrible. It's unforgivable, but can't nobody change it but you. You're the one. You gotta do your research just like y'all are doing right now. You gotta learn, and then you gotta apply it. And you can protect yourself and your family and your friends from all these disastrous complications that come from eating too many carbohydrates. You can do that.
Correct. And with everything that has been going on, one of the things, and sometimes they kind of get mad at me for saying it, but I've gotten to the point now that it's too dangerous to sugarcoat it. So I can't do that anymore. There are so many things that affect our community, but the one thing that I do have control over is what I put in my mouth.
100%.
So I can choose to eat healthy. So that's always a choice. Now, granted, a lot of the foods that we have been taught that were healthy clearly aren't. But like you said, this is an information age. It is up to us to go out and look for these things and know the root cause. That's my word now. I use root cause with everything, especially when it comes to our health. So we want to make sure we're addressing the root cause instead of just being okay with taking a prescription to medicate the symptoms of the issue instead of addressing the root cause. And 9 times out of 10 is usually all connected to diet and connected
99% of the time. Yeah,
right.
99% of the time. Maybe 1% of the time a prescription for a pill is the right answer, but 99% of the time the correct answer to correct the underlying root cause of the disease is fix your diet.
Exactly. Totally. But like I said, we really appreciate you guys. There are some of us in our group. Now, when I started keto, I didn't know anyone who was on it. No one at all. And even then, when I started it back then, it was kind of frowned upon in my community because, you know, being healthy has a stigma, or eating healthy has a stigma of, like you said, bland foods that taste like cardboard. So even then it had a stigma, and it still does to a certain extent.
Yep.
But it's up to us to reach out, continue to reach out and spread the word. And I use one of the slogans I see in schools: each one teach one. We have to just keep spreading the word, and eventually it'll get around. Now, when I started, it was just me, like I said, and now our group has almost 9,000, and it's
Beautiful.
Majority African Americans, and they're losing weight. They're reversing illnesses. And I always tell them that the biggest part of this isn't the weight loss. Weight loss is just a great side effect of that. The biggest part of it is healing, and healing those things that are making us overweight or making us not have the ability to lose weight.
Yes, totally agree.
So like I said, we really appreciate you guys. You guys have been our idols for. Oh, I had one other question because I was a little bit confused on it. I said, well, since I had you on, I was going to ask. One of the things that we had always, or that I had always thought was, if you have if you are hypoglycemic, or if you were breastfeeding, that you should set your carb count higher. But I also know that your wife actually did both, and she was still carnivore. Yep. So I was a little bit perplexed with that one.
Yeah, there's the truth of the matter is that there is no human who needs a certain amount of carbohydrates. That's just a myth. And that's really hard for nutritionists and dietitians who've been trained by the American Academy. They just know that you got to have so many carbs. But no, Nisha, she's still breastfeeding, and she's a ketovore. She every now and then will have some olives or an avocado or some broccoli or something. But most days it's nothing but meat, eggs, butter, cheese. That's what she lives on. Has a great milk supply. Beckett's growing like a weed. Looks great. He acts great. He's tall for his age, but he's not fat. He's just tall. And he's learning words. He's 9 months old now, and he's already pointing at. I mean, he's brilliant. So no. Now, I don't recommend that pregnant women or breastfeeding women do much fasting at all. Maybe don't do over 16 hours a day. But you don't need, if you've got hypothyroidism, you don't need carbs. If you've got no gallbladder, you don't need carbs. There's no condition that you need carbs. It just doesn't exist.
Okay, great. Let me check right quick and see if they have been asking questions. Some. Somebody wanted to know, because they hear me talk about carnivore a lot. They want to know from you what you think is the benefit of carnivore, actually.
So the ketogenic diet is a very low carbohydrate diet, right? And in my way of defining it, it's 20 total grams of carbs a day, max. Now, some people like to count net carbs, but that'll get you in trouble if you don't watch it. That'll be slowing down your weight loss. But if you say keto is 20 total grams or less a day, then a carnivore diet is actually a subset of keto, because if you think of carbohydrate intake as a knob on a stereo, right? So you turn it down from the standard American diet down to 20, that's keto. But what if you turn it all the way down as close to zero as you can get? That's carnivore. You've removed, because any plant is going to have some carbohydrates, right? But if you're only eating beef, butter, bacon, eggs, and stuff like that, you're getting essentially zero carbohydrates. Now, you're still getting 2 or 3 a day, because one egg's got 1 gram, liver's got a little bit, muscles got a little bit, but it's as close as you can get. So all you're doing is you're eating the ultimate keto diet. If you're eating carnivore, that's what it is. It's as low carb as you can possibly get.
Now, and when I first started keto, and I'll tell you what actually made me decide to do it. You did a YouTube video and you were talking about how our ancestry has a lot to do with our eating. And so when I thought about where my ancestry came from, Africa isn't thriving with vegetables and fruits. They hunted and ate. And so I was like,
Exactly.
I think it'll work good for me.
Yep.
And I also thought, I was like, I can't feel any better than I already do. Keto makes me feel amazing. Well,
Yep.
let me tell you, I was wrong. I started feeling better than I did even on keto. And it really shocked me because I wasn't even expecting that part. And the other part, I think that shocked me was, and you actually talked about that once too, because we automatically assume once I get rid of the plants in my diet that I'm going to be constipated. And that is not the case at all.
Nope, not at all. Yeah. And I think everybody in your group, once they're keto adapted and they've got used to keto and they're enjoying it, I would encourage everybody at some point to just do 1 month of fatty meat carnivore. Just call it a trial or a challenge. I'm going to do carnivore for 1 month, because what Keisha just said is absolutely true. When I was on keto, I was feeling great, but I saw this guy, Dr. Sean Baker. You've probably seen him out there, right? Yeah. And he just eats ribeye and drinks water. And I'm like, well, now I can't be outdone by him. He's an orthopedic surgeon, right? So I had on my Facebook group, I said, hey, let's do a carnivore challenge. Let's do 30 days of carnivore. And keto had reversed so many of my chronic medical conditions. When I first started all this, I weighed 297 pounds. I was morbidly obese. Can you imagine this big old fat doctor coming in the room telling you need to lose weight?
We see it often.
You're right. That was me. And where I come from, you got to be 1 + 1's got to equal 2. I'm sorry. You can't come in being a fat doctor and tell me to lose weight. That don't make no sense. Right. And one of the things that got way better with keto was my heartburn. I had terrible heartburn every day. Got 80% better on keto. And so I come around, I'm like, yeah, let's do this carnivore challenge, right? At the end of that carnivore month, I had not had heartburn a single day that whole month. And I had never had a month in my adult life of not having severe daily heartburn pain. It was way better with keto, but with carnivore, it was and still is gone. I've been carnivore for 18 months now. No heartburn. Like, I don't even remember what it feels like to have heartburn because it's been so long since I had heartburn. And so for me, carnivore gives me all the benefits of keto plus a little more. Now, it might not do that for everybody. Some people might not like carnivore, and that's okay. You just go at the end of your carnivore challenge, you go right back to keto and you live your happy life, whichever works best for you. I just want you to have the option and know that it is a viable option.
Right. So you guys, now you know I'm not crazy because we actually just started the carnivore challenge. So
she may still be crazy, but that ain't why.
Right, exactly. So now you know why. Another question. When we say reversal of disease, can you completely get rid of diabetes?
100. Okay, that's a great question. So the way a doctor diagnoses you with type 2 diabetes is if you have a hemoglobin A1C of 6.5 or higher. That is the definition of type 2 diabetes, right? And so if you've got an A1C of 6.3, are you a diabetic? No, you're pre-diabetic, but you're not diabetic. Only when it gets higher than 6.5 do you then become a type 2 diabetic. That's the definition. So if you do keto or carnivore or ketovore, and you reverse your A1C and make it go down and you get it under 6.5, do you still meet the definition of type 2 diabetes?
No.
No, you don't. And when you get your A1C down under 5.7, are you pre-diabetic anymore?
Nope.
No, you're not. You don't meet the definitional criteria anymore. So how can you say, and there are doctors out there who'll say, oh, you're still diabetic. I don't care what your A1C is. diabetes has a definition. If they meet the definition, they're diabetic. That'd be like them telling a 12-year-old kid that's skinny as a rail and never had any blood sugar problems, oh, you're a type 2 diabetic. Based on what? The kid his blood sugar is normal and their A1C is 4.9. How are you going to call them? Well, it's just in remission right now. When they get older, it'll come back. That's dumb. No. If you don't have a hemoglobin A1C over 6.5, you are not a type 2 diabetic, period. And so
correct.
if you start this keto journey and your A1C is 9, 11, 14, when you get it under 6.5, congratulations, you're no longer a type 2 diabetic. Congratulations.
Great. Okay. Next question. If a person is on cholesterol medicine, what recommendations can you offer to reverse the high cholesterol while on keto? I know the answer, but I would.
So don't worry about it if your total cholesterol is high. It is not a risk factor for heart attack and stroke, like you were told it was. Your doctor was taught that by their professors. They believe that, but just because your doctor believes it, don't make it true. Don't ever forget that, okay? If you're taking a cholesterol medicine for high cholesterol, you can throw that crap in the garbage. You don't have to wean it down. You don't have to do anything. It's not helping you at all.
Right.
Now, on your lipid panel, there's two other tests called triglycerides and another one called HDL, which a lot of doctors call the good cholesterol. When you're eating a low carb keto diet, your triglycerides are going to come back down to normal. There's no pill that can make that happen. When you're eating lots of fatty meat on your keto or your carnivore, your HDL is going to go up. Those are actually the two numbers that you're concerned with. I don't care what your total cholesterol and your LDL cholesterol are. It doesn't matter. They are not risk factors for heart attack or stroke.
Exactly. Next question. How does regular high intensity exercise affect the keto way of eating?
Well, if you're doing high intensity exercise, that's going to help build your muscles.
Right.
That's going to help make your bones stronger. There's tons of research that shows that high intensity exercise is excellent for your brain and for your thinking ability and for preventing dementia. It's great for all those things. And so it works hand in glove with the ketogenic diet. So if you're eating the proper human diet, which is what I think ketovore, carnivore is, and you're living the proper human lifestyle, which is once a day, every other day, do a few minutes of a high intensity exercise, what you're doing is you're mimicking how we have lived and eaten for the last 250,000 years. That's a good strategy for optimizing your function and your health, both physical health and mental health.
Correct. This is actually my question. Because I'm asked this one often, and I don't think many tend to believe it. So when we talk about the children, when it relates to their health and their lifestyle, and we know that adolescent diabetes is growing at an epidemic rate. The age group for obesity in America, the fastest growing age group is children ages 3 to 5, which they aren't fixing their plates. They aren't deciding what to eat or anything. But we see a lot of people who want to do a healthy lifestyle, but then they don't want to bring that lifestyle over to children. So is a ketogenic lifestyle or carnivore healthy for children to do?
Well, let's just think this through logically, common sense. You were talking earlier about your ancestors in Africa. Your great-great-grandmother 1,000 generations back, when she was a little girl, when she was 4 or 5 years old in Africa, what did she eat every day? Did she eat little Lunchables and crackers and big green? No. What'd she eat?
She ate what the parents ate.
100% of every day of her whole life, she drank breast milk until she got some teeth, and then she started chewing on those rib bones and chewing on those chicken leg bones, just like Beckett did when he was 4 months old. The first solid food he had in his mouth was a rib bone that I had pretty much cleaned up, and I give it to him to finish it up. That's how human beings have done it ever since we've been on this planet, and that's the way we should continue to do it. Children are small humans. All humans benefit from eating the proper human diet, which is a low carbohydrate diet full of fatty meat. That is the proper human diet. If you want to add some veg, you can. If you want to add some berries every now and then, you can. But you got to have the fatty meat, and it can be seafood. It doesn't have to be red meat if that's against your religion or you just don't like it. It can be, you can have a keto diet full of seafood. It's fatty. There's plenty of fat in that. You can do just fine with that if you don't want to eat red meat. I think you can do it with pork and chicken, but some people don't believe that. But I think that's 1,000 times better than eating the Cheetos and the Doritos.
Exactly. Someone wanted to let you know, she's actually one of our biggest success stories when it comes to healing. She is now a 6.6, and she's been on keto a year and a few months now. So yeah.
And where did she start?
14.8.
Oh my God, that's terrible. Wow. So she's done. That's such an amazing. That's so amazing. So she's 2/10 of a point from reversing her type 2 diabetes. 2/10 of a point. I mean, it's going to happen. Just keep the carbs super low, and the next time you go, you'll probably be a 6.4 or 6.3. That's so amazing.
And let me add, because I know I've talked to her many times. Her arteries, everything is, on point. She doesn't have any buildup or any of that. She's actually the healthiest she's been, I think, in her adult life.
Excellent. Let me talk about this for a second, because your people need to hear it. You've heard the term, oh, they got a touch of sugar. Yeah. So there ain't no such thing as a touch of sugar. Okay. So when your person there gets her A1C under 6.5, she's no longer a type 2 diabetic. That's true. And that's a great victory, but she is still absolutely a pre-diabetic. Okay.
Correct.
Damage is still being done when you're a pre-diabetic. And there's a lot of doctors out there, if your A1C is 5.8 or 5.9, they'll literally say, oh, you got a little touch of sugar, but it's no big deal. Don't worry about it. I'll see you in a year. Terrible advice. There was actually research done that proves beyond all doubt that if you're a pre-diabetic, the damage is being done to your kidneys, being done to your eyeballs, being done to the little arteries in your toes and feet. It's being done to the arteries in your heart and brain. The damage is being done. So I'm not trying to scare anybody. I'm just trying to let everybody understand that when you get out of type 2 back into prediabetes, you won a battle, but you still have not won the war. The war is won when you get your A1C under 5.7. Then you've hit a grand slam. You can give everybody a high five and you can go celebrate with some bacon.
Okay. And since we're talking a lot about diabetes, because we know that's actually one of the most one of the health conditions that really, really affects our communities. And when I started getting into what insulin actually is and what it does, I kind of started shaking my head saying, wait a minute, this is actually kind of making this issue, along with diet, a progressive disease. Because I don't know of any diabetics who are actually doing that calculation to determine how much insulin they should actually be taking. So, of course, they're taking more than they need at times, and it actually is making the situation worse.
Exactly. That's exactly right. And if they're still eating the diet that is recommended by the American Diabetes Association, then they're eating way too many carbs. So they're going to be taking too much insulin every single day.
Correct. Let me see if I have any other questions. Make sure I get through them. Like I say, they were excited. They've been excited all week long.
Well, I'm excited to join you guys. This is great.
I think I got all of their questions. 5.7. Yeah, we did. One other thing, because I actually have a couple of people who are dealing or who came to keto for this reason too, because we know there are some fertility doctors now who are suggesting keto as a first option because it's a lot cheaper than fertility treatments. So
and the part they don't tell you is it works way better than the fertility treatments. Yeah, it's way cheaper and works much better.
Can you tell us the reason why keto has become one of the things that fertility doctors are choosing to do now?
Yeah, one of the main things that impedes a woman's ability to get pregnant is PCOS. And whether you have that official diagnosis or not, if you're eating too many carbohydrates and you have chronically high levels of insulin and chronically high levels of inflammation in your body, then you're going to have some degree of PCOS symptoms. Even if you don't have the diagnosis, it's kind of like a touch of sugar versus diabetes. You still having problems with your glucose insulin metabolism, even if you don't have type 2 diabetes yet. Same goes for these women. And when you have PCOS, it's very, very difficult to get pregnant. That's the most common reason that women have trouble conceiving is PCOS. And so you could think of it, even if they don't have the diagnosis of PCOS, they have pre-PCOS, which is still going to lower your odds of being able to get pregnant. When you go low carb keto or ketovore or carnivore, you lower your blood sugar back to normal. That's going to let your insulin level come right on back down to normal. And then any inflammation you've got in your pelvic organs or anywhere else is going to get less. And I'll tell you a story. When I had the clinic in Camden, I had two women. One was in her late 40s, one was in her early 50s, and they were both starting to go through the change. And they both started keto, and within a few months, both of them got knocked up. They were both married.
We have some issues of that too now.
They were both married, but neither one of them were happy with me for a few days because they were not prepared to go through all that again. So I'm just telling you, I've never seen another diet where people say, I started that Weight Watcher diet you told me about, and 6 months later I got pregnant. I've never heard that once from a patient in my whole 20 years. But the keto diet will get you pregnant. If anything's going to, the keto diet and then a good-looking man, you're going to get pregnant. That's what's going to happen.
You hear that? Keto and a good-looking man. That's a combination to get pregnant.
Got to have both of them.
You got to have both, not just one. It takes both of them.
That's right.
Somebody also was talking about keto has actually reduced her glaucoma pressure in her eyes.
Yep, I've heard this multiple times. I don't think there's any research on this, but I have heard multiple people with glaucoma, and I have a family history of glaucoma, so I have to go get my pressure checked every now and then. But I've had multiple people tell me that their doctor was perplexed because they couldn't understand why their pressures had returned back down to normal. We don't know exactly why that happens, but I've heard it so many times that it can't be a fluke.
Okay, and on that, one of the other things we have been talking about lately, and I haven't seen any literature on it, is our allergies seem to go away.
100%. Remember when we were talking earlier about our immune system?
Right.
It don't make no sense at all for our immune system to get all tore up about cat dandruff or ragweed pollen. Those things are not dangerous. We shouldn't be having this full-blown reaction from that. And I'm speaking from personal experience here. I used to be the guy, if you just said, hey, let's go and pitchfork some hay. I didn't even have to go to the barn, just the thoughts of it, and I'd have a stopped up nose for 3 days. Right. I had terrible allergies as a kid, and it came from two things. It came from me drinking lots of low-fat dairy and eating lots of carbohydrates. Those are the two things. When I stopped the low-fat dairy, because I thought that was healthy back then, I didn't know better, right? My allergies got 80% better. And then when I went keto, I have not had an allergy symptom in 7 years.
Same here. I haven't had any. My seasonal allergies, and I live in South Carolina, so this is the state where we always have allergies.
Absolutely.
They have completely gone away. And
but when you give your immune system a chance to calm down and to truly just be able to look around and say, oh yeah, we got some cat dander in our nose. That's no big deal. We'll sneeze one time, get it out, then we're done. That's all we need to do. We don't need to have this big production and have, 10 days of having to know right where the Kleenex box is at all times. You ever done that? It's like, no, I just carry it from room to room with me because I know I'm going to need it. You don't have to do that anymore because your immune system now doesn't get freaked out because, there's some ragweed or cottonseed. It doesn't do that anymore. It has an appropriate response, which means now if I went to the barn and pitchforked hay, I'd probably sneeze 1 or 2 times while I was in the barn. After I got home, that'd be it. I'm not in the barn anymore. I'm not around that stuff. So I wouldn't have that 4-day flare up of hay fever or allergies that I used to would have had. That's evidence that your immune system is in a much healthier place now than it was back when you were drinking the skim milk and eating all the carbs.
Well, that makes sense. 2 more questions, guys, and then we're going to have to let Dr. Berry go. Next one. What is your take on, because when we look at now, I tell them it is so different when it comes to information on keto than what it was when I first started 2.5 years ago. Now we see all of this information and all of these things, and a lot of times they get confused because a lot of things they see in a lot of groups, I'm like, no, this isn't what we're doing because health is first. So no, we're not into all of this other stuff, of course. And so they want to know, what's your take on the differences with dirty, lazy, and clean keto, strict keto?
It's a great question. It depends on how metabolically unhealthy you are.
Right.
Okay, so if you're 25 years old and you're pretty thin and your A1C is normal, then you can do dirty keto, lazy keto, and you're going to get some benefits from that. But you're pretty healthy to start with. You don't really need a ton of benefits to feel like a normal human again. But if you were like our friend that we were talking about earlier, who had an A1C of 14, she don't need to be doing no lazy keto or you know what I'm saying? She needs to go hardcore. Right. And what I consider real keto is 20 total grams or less a day, real whole 1 ingredient foods. And so I don't even consider the keto cookies and cakes and pies and candy bars and shakes and all that. That's not real keto in my book. It's keto-ish, it's dirty keto. And if you're young and metabolically healthy, you can play around with that stuff. But if this, when your A1C is 14, that's life or death we're talking about. You could literally die in your sleep tonight if your A1C is 14. You understand? And so if your health is compromised to any meaningful degree and you are metabolically unwell, you need to take this dead serious and not be doing nothing lazy about this. You need to do real keto. And then when you've got your A1C back down to 5.2 and you've lost 142 pounds, then if you want to have a keto shake or a keto cookie, hey, go for it. It's fine. Because now you've reached a place in your health where you can do some lazy, dirty keto. But if you're trying to get the most benefits health-wise as quickly as you can, then your keto better be pretty damn clean.
Yeah, I agree. And the thing with me was when, now I started out doing some of those things, but the longer I stayed on keto, now I absolutely have zero cravings whatsoever, not even for keto treats.
Right, that's right.
I have,
and that'll happen to most everyone.
Yeah. Okay, last question, and I've never heard this one. So why does your dentist ask you not to do keto if you plan on being numb to have dental work?
I have no idea.
I've never heard that.
Yeah, the numbing agent that they use is going to work fine whether you're keto or not keto. Actually, when I was working in the emergency department, if somebody would cut their foot or cut their leg and I would have to numb them up with the same kind of medications, I found that people who were morbidly obese and who had high blood sugars, I found it harder to numb them up than I did people who were young and metabolically healthy. So I'm not sure what that dentist means by that.
Yeah. I had never heard that either. Okay, so we had our hour. Again, we totally appreciate them. They say they really appreciate you. I see a lot of thank
My
you
pleasure.
going on. And one of the things I always tell them is that we can stop these generational curses when it comes to our health. And what we can do is start doing this and teaching our children.
Yes.
When I first started on keto, I always felt so bad because I was like, oh my goodness, when I thought about what my kids grew up on, Chef Boyardee and the Happy Meals and all that, I felt awful because they were being adults and their eating habits were just awful. But now I'm glad to say they are both keto and doing extremely well. So
I love what you're doing. I love your message. I hope you don't ever stop doing this.
Well, thank you. I don't plan to. I actually love it. They know I am a keto nerd. In the middle of the night, this is what I'm doing. So
that's it.
Thank you so, so much. And again, I just keep seeing the thank you, Dr. Berry going on.
My pleasure. Thank you guys for having me. It's an honor.
All right. Well, you have a good one and we'll talk soon.
Yes, ma'am.
All right. Bye-bye.
Bye.